Thank you, Mr. Chairman. Mr. Ratcliffe, Mr. Honorable Ratcliffe, thank you for your service in Congress. Also, thank you for your service as former Director of National Intelligence during a tumultuous time during the origins of this disease process. Recently, Director Wei confirmed the FBI report stated that the COVID-19 pandemic was likely the result of a lab incident in Wuhan. Based on your knowledge, do you agree with the report from the Department of Energy as well?
I agree with both the FBI and the Department of Energy.
Thank you. In your testimony, you stated, and I quote, "Our intelligence has led to a demonstrable shift whereby a few of the intelligence community's 18 agencies are now publicly assessing that the COVID-19 virus originated from a lab leak in Wuhan. And as this shift continues, the day will come when every single agency in the intelligence community will make the same assessment," end quote. Do you think there is another federal agency close to falling on the side of the Wuhan lab leak theory in the near future? And if so, which one?
Well, I've talked about, again, I'm not in the intelligence community now, but of course, have friends that are career individuals still serving in agencies. My understanding is that that in most of the agencies, there is a shift. More and more analysts believe that a lab leak is the most plausible, if not the only plausible assessment to make, and that it's a minority in most agencies that are holding on to the idea that this is naturally occurring. I would hope, as I talked about, the fact that the CIA would make an assessment at some confidence level, and based upon my personal knowledge of conversations about analysts within that agency, I believe that a great majority of those analysts do support the Department of Energy and the FBI analysis, and it is a minority opinion that is currently holding back the CIA from making that assessment that a lab leak is the most plausible.
And certainly, in your estimate, in the last year, is there some new information that occurred, or do you think the CIA could have come to that conclusion probably about a year ago or so?
Well, I think we certainly could have. All agencies within the United States intelligence community could have made an assessment at some confidence level a year ago on this in favor of a lab leak. My understanding specifically from the Department of Energy that there was new intelligence that persuaded them to make their assessment of a lab leak. So new intelligence is always being gained. But again, from my standpoint, the more time that passes, the further we get without anything tying COVID-19 to nature. So I talked about no environmental source, no intermediate host, no reservoir species, none of that. It makes it less and less likely that this was a natural origin.
I think as a physician of emergency medicine and as a scientist, I think I thoroughly agree with that assessment. And in fact, I think it could have been reached a long time ago, in my opinion. I think the fact that we're even having this conversation is absurd. It's very easy to identify whether there's animals in the wild that have or have not this disease. The fact that the Chinese have literally spent years and incredible efforts trying to obtain that information and have received zero information supporting one theory, whereas we know there is an incredible amount of evidence on the other side of that points to one thing, and that's a CCP cover-up. This unfortunately leads me to the conclusion that the efforts of this administration, Dr. Fauci, the WHO, and multiple bureaucracies are willfully or ignorantly colluding with the CCP. That's what bothers me. Director Ratcliffe, as you know, this committee was formed on the basis that we would seek the truth to create recommendations to face the future pandemics. With that being said, I have one last question for you. And in your opinion, what reason could the administration, public officials, and many of our federal agencies have for hiding the truth from the American people? And if you can't speak to that, what effect do you think this has on the American people's trust of their public health officials and the government?
Well, I would say that, China has been identified as our number one nation-state adversary. They've been described by the current administration as a strategic competitor, but our intelligence clearly tells us they are an adversary. Their public actions very clearly dictate that they are an adversary, and I think that the current administration, for whatever reason, has been reluctant to confront China on any number of issues or transgressions that have taken place publicly, from spying, a spy balloon that flew over the country, threats against legislators in this body from landing in Taiwan. The list is long, and there hasn't been an effort by the current administration other than to say we're not seeking conflict with China. And I think that is continued with respect to this issue into COVID origins.
I agree with you. I don't think we can learn from this if we're not being honest. We can't prepare for the next pandemic if we're not being honest. We have obvious answers that we want to ignore. I think we've been biased. I think we have to really acknowledge this. If we're going to prepare for the next virus, Mr. Chair, I think we cannot disallow that we've already had multiple viruses from animals in the past, but we're not doing what we need to prepare for with Wuhan leaks and disallowing gain of function. With that, I yield.